Hi there, my name's Max, and today I'll be presenting exercise prescription for stroke survivors. To start off, what is stroke? Stroke is a cerebrovascular event that results in cell death in the brain. There are two major types. There's hemorrhagic and ischemic. Hemorrhagic is what happens when a blood vessel in the brain ruptures, causing bleeding in the cranium. This increases intracranial pressure because the blood fills the cranium, which is kind of a closed system, and it compresses the brain, uh, damaging cells throughout the brain. The second type, which is more common, about 83%, uh, around 85% of strokes are ischemic, the other 15 hemorrhagic. Ischemic stroke is when a blood vessel that supplies the brain with oxygen is blocked, usually by an atherosclerotic plaque that is broken off somewhere else in the body. That plaque makes its way to those narrower vessels in the brain, and it blocks it, causing a lack of blood flow to that part of the brain. Those cells will then suffer ischemia and eventually die. Um, and it can cause very acute, specific symptoms depending on where that blood vessel was supplying oxygen to. Common complications there's a wide range. Depending on the severity of the stroke, you can have someone walk away with no symptoms, no long-term effects, and people can die if it's not treated properly or t in a timely manner. But common complications of people who do survive stroke and come away with long-acting symptoms or long-term symptoms are the inability to move on one side of the body, numbness or strange sensations, peripheral pain in their hands and feet and legs and arms, excuse me, weakness on one side of the body, cognitive deficits, especially if that's where the event happened, especially in a ischemic stroke. If that part of the brain was cut off from oxygen, then uh, the part of the brain that's managing cognition will suffer. Problems with speech, emotional control and depression, also the same thing. Um, Yeah. So those are some complications that you'll see. And you can probably start to tell how that might affect your exercise prescription, especially with the numbness and neuromuscular issues that might be happening. Medications that people are prescribed when they've had a stroke include antiplatelet, anticoagulant, statin, beta blocker, and a variety of other medications. The reason it's such a widespread is because stroke patients often have comorbid conditions, including heart disease, high blood pressure, diabetes, and COPD, among others. These conditions can exacerbate or actually cause the stroke, which is why there's such a wide spread of medications that they might be taking because they might be treating those other conditions or have those conditions come to light because of the stroke. Specific medications include aspirin, dipyrid dipyridamole, uh, clopidogrel, beta blockers, and ACE inhibitors. There's a variety of others, but these are some main ones. Aspirin can interact with exercise prescription because it might delay the healing of any injuries that they suffer, and it's a painkiller. So if they suffer an injury, they might not notice or think it's as bad as it is. So you're gonna have to keep an eye out on that. Dipyridamole can cause angina exacerbation and hypotension because shortness of breath and dizziness as well. It's an antiplatelet medication and a vasodilator. Vasodilators will be common for stroke patients, uh, for ischemic stroke patients. Um, Hemorrhagic stroke patients can take like medication that make it easier to make clots, but that's rarer. Um, Most antiplatelet and anticoagulant medications will come with a bleeding risk. So if they get cut, they might just bleed and bleed and bleed because their blood is not doesn't coagulate. It doesn't cause the normal process of healing a cut and wound. And beta blockers and ACE inhibitors share a reduced blood pressure response to exercise. Um, Beta blockers will lower the heart rate and have a lower aerobic capacity, and ACE inhibitors can have hypotension. Uh, so yeah, keep an eye out on those for exercise prescription. When you're getting to know your client, it's good to take note of the type of stroke that they had because that'll inform their history and what comorbid conditions they might have. Take note of those as well because they're going to be treated for that and their medications might be relevant to that. And your exercise prescription should address any underlying conditions that may have caused the stroke or may have exacerbated it. Um, the medical treatment that they're receiving, their medications, like we just mentioned, but their lifestyle changes, any like their level of activity since their stroke and like what they're eating, that kind of thing can inform your advice to them as a kinesiologist and any surgeries they might have had. Their medical history, you know, if they've had any injuries, if they fell when they had their stroke or uh, anything like that. And when you should refer them to another healthcare professional is if they have hypertension that's unmanaged, like their comorbidities are not managed, then that needs to be taken, that needs to have a look at it taken. You know, a doctor should be treating those. Um, Uncontrolled symptoms consistent with unstable angina. If you notice they're having unstable angina or anything like it, also needs to be sent to a doctor. And if they have severe neurocognitive issues, it might be difficult to work with them. It might, it might get in the way of being able to do a proper exercise program. Contraindications when you get to um, thinking about doing a test or anything like that. Relative contraindications include fatigue, shortness of breath, claudication, um, an exaggerated hypertensive tensive response, and weakness in limbs might be new. Um, these are all like they might be experiencing weakness in their limbs because of their stroke or because of a previous stroke, or it might be because they're experiencing another one or um, yeah, so just keep an eye on that. If it's consistent with their medical history, um, then you can proceed. If it's known, if it's unknown, then it might be an indication to stop the test. Absolute contraindications include the fast symptoms. If they're having another stroke, you have to stop the test, stop any exercise. And the rest, actually, uncontrolled vestibular or visual disturbances, is another sign that they're experiencing another event, at least. This would be like them seeing things that seeing things or the loss of vision, as well as loss of balance and ability to stay upright and dizziness and confusion. That's an absolute contraindication. The rest are pretty, we've talked about them in class a lot. Um, they are like that normal list that we have, the ST changes, ST segment changes, the uncontrolled hypertension, the unstable angina, the CNS symptoms. Um, Stroke survivors often have the diseases that we've discussed, like diabetes and, like I mentioned before, cardiovascular disease. So, yeah, the what we've taken a look at already is pretty accurate for stroke survivors. And some factors, once you're past contraindications, factors that you should be keeping in mind while doing exercise testing is that cognitive impairment can like make it difficult. It might make it you know, stroke survivors can be irritable. They can also have impairments in memory and like the concentration, the ability to understand things. So you might have to be patient and you might have to be um, You might have to repeat things and show them more slowly, you know. Their balance might be impaired as well as motor function, so their ability to do the test might be somewhat impaired. So you can definitely ha do some modifications, which we'll talk about. And remember that they might be taking a lot of medications. So just like make sure that's on your chart. Know what they're taking and how that might affect exercise during testing. And the test that you should do, and some modifications that you can also do. Um, the ACSM recommends doing submaximal testing because, especially when there's cognitive and motor impairments, because doing maximal testing when you are likely in poor training status and are rebuilding your neural network and your ability to control yourself, your fine motor skills, um, maximal testing is kind of unfeasible. ACSM also recommends doing um, ergometer work because that kind of takes the balance aspect out of it. So cycle ergometry, dual action semi-recumbent seated steppers, which is uh, it's like fancy equipment to kind of reduce that balance aspect. But if their balance is good enough, and you have the equipment, walking aids and harnesses can be used to modify standard treadmill tests. And treadmill has its place. It'll tell you how well they can, their self-efficacy status and how well they can kind of walk and take care of themselves. So, you know, if you have the equipment and the knowledge and know-how, you can use those modifications. Measures, you're going to be taking all the normal ones: blood pressure, heart rate, oxygen saturation, RPE. If you are If they have comorbidities, any relevant scales would be important. So, COPD, get that dyspnea scale, make sure that they're breathing well. That angina scale also for cardiovascular disease, claudication, if they're having blood clots, they might have peripheral arterial disease as well. Any of those relevant scales, and of course, fast symptoms. If their face is sagging, um, if their speech is slurred, then get them off the treadmill, get them off the bike. Um, Make sure you're keeping track of it. Stroke survivors do not typically meet the 24-hour movement guidelines. Having a stroke really can be a big barrier for that, especially with those cognitive and neuromuscular issues. So, studies have found that stroke survivors are engaging a lot in sedentary behavior, and are usually doing light physical activity as opposed to moderate and vigorous physical activity when they do get out. And so, um, exercise prescription is really important for them because, to restore their ability to, their ADLs and their self-efficacy, it's hard to do on their own, and it's hard to do without professional advice. And it'll cause declines in their health in terms of, BMI, physical function is impaired, and it can lead to frailty and further cardiovascular disease if they're not meeting the 24-hour movement guidelines. So, prescription split into three phases, according to the ACSM. Acute is within a week after the event, and the focus is on mobility and ADL level activity. So, like nothing too crazy. We're not getting into exercise programs within a week. The focus is on mitigating that atrophy of strength, muscle mass, and physical function. Um, After a week and up to 6 months is called the subacute phase. This is where you might be initiating an exercise program, especially if they're recovering well. This is also where you get a better idea of their chronic symptoms, like what they're going to be dealing with for a longer amount of time, because they're still healing within a week, as opposed to up to 6 months. And so you can get a better idea of how to initiate that program. And then after 6 months, it's called the chronic phase. And that's where you're trying to progress in in that exercise program to exceed or meet or exceed the pre-stroke fitness. So you're trying to really get them back to where they're at. And especially in the case of people with cardiovascular disease and an already sedentary lifestyle, you're trying to get them even better. Um, Fit principles. So actual prescription, the ACSM has their own chart here, which I've just thrown in because I would be just repeating what they have to say about it pretty much. Um, Aerobic is especially useful for stroke victims as it's a cardiovascular, cerebrovascular disease that it's an event that has to do with their blood vessels. So aerobic is especially important when doing this. Resistance training, we'll get to how it can help, but specifically, it's a pretty standard 50 to 80% intensity of their 1 RM, 1 to 3 sets, the normal stuff. Same with aerobic, moderate vigorous, um, keeping an eye on their heart in the ECG. Um, and yeah, they mention here that the type of aerobic and resistance training that they should be doing should kind of mitigate that balance aspect as well, just like the testing, because they should keep balance training in its own section. And if they're trying to get their heart rate up, they shouldn't have to be worrying about balance. So get him into the machines, get him on a cycle, like a spin class, for example. Um, Treadmill and overground walking can be considered if there's sufficient balance and they don't need. The focus for that is heart rate and, getting that moderate vigorous level rather than balance. And you can focus on balance in its own time. Um, Same with resistance training, getting them on a machine rather than free weights, that kind of thing. And exercise helps. Surprise. There are numerous physiological adaptations, and the response to exercise is strong in stroke victims. Studies found that they had increased aerobic fitness. Doing aerobic exercise increased the elasticity of the heart and lungs, helped their cardiovascular system, and increased their VO2 max, as it does in healthy populations, but especially so for stroke survivors. Cognitive function improved with exercise. Their brain got better oxygen, blood flow, and brain cell regeneration. Um, it just improved their healing and uh, kind of mitigated that decline, that cognitive decline that can come after a stroke for most people. Balance improved with stretching, aerobic exercise, and dedicated balance exercise. Um, yeah, aerobic exercise will help. Their timed up and go tests and Berg balance test scores, they're getting that neuromotor connection better. It improves all that. Spasticity is an issue in stroke survivors, which is basically involuntary contracture of their muscles. This has to do with the motor and neural issues that can happen, especially if their neural part of the motor control part of their brain is affected by their stroke. And resistance training specifically can help with this because it requires so much um, specific controlled contracture. And so it can really restore that control over their muscles. And yeah, in general, studies found that quality of life in stroke survivors improved with exercise, mobility, regaining control over their nervous system and their ability to take care of themselves really helped them, and as well as the normal mental health improvements with exercise, endorphins, reduce stress, and that self-efficacy can really restore someone's confidence and bring them out of that depression that can be a serious symptom of stroke. So that's that. Thank you for watching. Thank you for accepting my late submission. Um, that's not my name. I forgot to change that. Um, yeah, those are my references. Thank you so much.